Good morning, everyone. I'll give you all a minute to get here. You know what? I'm gonna find my headphones. Never mind. All right, everyone. Good morning. Oh, my dog is going to be with us today. I had you all submit questions that you have for just a rapid Q&A this morning. We'll get this done pretty quick. It will be recorded. Remember, none of this is medical advice. I'm probably not your doctor, and even if I am, taking general advice from a person over the internet is not a good idea. Always ask your doctor if you have any questions before changing anything, adding anything to your plan. All right, we're gonna go over just questions people had about VRT, vestibular migraine, vestibular neuritis, all those kinds of things. If you have any more questions throughout this session, you can just drop them in the comment box and I will try my best to get to them, okay? All right, let's get started. We're gonna start with vestibular migraine. I ordered them kind of by category. So, first of all, let's talk about vestibular migraine. It is a kind of migraine you don't necessarily need the headache for, but it does cause vertigo, dizziness, imbalance, etc. So what kind of symptoms does it cause? We kind of just went over that. Everyone is really different with this. It's really important to realize that you don't have to have a very specific symptom. Like if one person has imbalance and they have vestibular migraine, you can still have vestibular migraine, just not be imbalanced. It's really different for everyone. There are a set of diagnostic criteria that you can find on the internet. You can find them on my website. They're kind of spread everywhere. Pretty easy to find. Just Google vestibular migraine diagnostic criteria when we're done today, and that will pop up. You do have to have some symptoms like light sensitivity, sound sensitivity, maybe an aura, but you don't have to fit every single category. It's a very broad spectrum of categories. Other symptoms include vertigo. So you can have positional vertigo, recurrent BPPV, and that's often misdiagnosed in vestibular migraine because so many people are diagnosed with just regular BPPV who actually have vestibular migraine. Someone wanted to know if it causes arm weakness. Hugo. Sorry, my dog drinks too much water. Hugo. Good boy. Okay. If it causes arm weakness. I would ask your neurologist this question. This is not medical advice that I can give over Instagram, unfortunately, but I did want to address it because a lot of people do have symptoms that are different from other people. So it's important that we recognize, like, hey, when I get vestibular migraine, when I have an attack, my arm feels really weak, and that is definitely something that can happen, but it's not necessarily something that you shouldn't mention to your neurologist just because it can happen. So any new or changing symptoms is always something that you should tell your neurologist, neurotologist, ENT, physical therapist, whoever is on your healthcare team. The next person wanted to know about vestibular migraine and eye pressure and going cross-eyed. So let's just to be clear, going cross-eyed is like this, when your eyes cross together in the center. I do have a couple of vestibular migraine patients who have complained about their eyes feeling uncontrollable and like they have this thing where their eyes go in and then eyes come back out, and they're really not sure why that happens, but it happens throughout the day or just during an attack. So again, it's something that can be maybe a part of your symptoms, but it's always something you should mention to your neurologist just to make sure you don't need imaging. You don't need to go see a separate specialist like a ophthalmologist, neuro-ophthalmologist, something like that, because that could be an important part of your team if you're not really sure what your eyes are doing. Most people, not most people, but many people, however, do have issues with eye pressure, and that's just because the way that your nerves are here can really cause a lot of eye pressure with people with migraine and vestibular migraine alike. So if you're having trouble with eye pressure, again, tell your doctors, but treatment can be helpful with that. So a lot of people wanted to know about the migraine diet. I think this is both the best thing to happen to people with migraine, but it also can really send some people kind of overboard. So if you're the kind of person who is really great with going on diets and you're like, oh, I'm just going to go on this thing, see how it works, that is excellent. I think it can be really empowering, and the Dizzy Cook talks a lot about how it's really empowering, because if you have migraine and you all of a sudden know how you can control it naturally in your life with just your diet, that is phenomenal. Good for you. I think that's great. For some people, it makes them really afraid of food. And if you're really afraid of food, that can be the opposite of empowering. So if you are a person who gets on the migraine diet and your anxiety increases because you just don't know what to eat and things aren't going well, first I would implore you to read about it, do some research, see what your triggers might be. But being really strict on a diet isn't necessarily the best thing for every person. And I think that everyone who advocates for the vestibular migraine diet will agree with that. So yes, it can be really, really empowering. It can be great, but for other people, it's not the best thing for them. So really do some self-reflection on that and decide if that's the best for you. With a lot of my patients, we go through a process where you read through all the information, you see what all the possible vestibular migraine food triggers are, you track your own food and your symptoms and see if you can kind of match those things and then get rid of those afterwards. And I think that it's really important to do that and to go through this process rather than just cutting everything out for some people, because if you do it that way, it can be a lot less scary for some people. So it's really, really important to know the kind of person you are, and it's important to know what you are going to do. Someone's asking, and it's important for this, how do you find the migraine diet? So you can look at the Dizzy Cook. She is wonderful. Alicia Wolf. She is, like, in my opinion, the queen of all things vestibular migraine diet. You can also read the book, I think it's called 1, 2, 3 Heal, or something to heal your headache. It's on Google, but Dr. Buckles wrote it, and that is what all of Alicia's stuff is based off of. If you haven't read also Dr. Shin Bei's book, I would absolutely recommend that. You can find them all on my website, or you can find them on Amazon. Any of those things are great. Yes. Someone in here is saying lists all the foods that are migraine triggers, etc. Absolutely. If you want a consolidated list, again, thedizzycook.com, not my website, it's Alicia Wolf's. She's great. That will be really helpful for you. Please talk about the weather. So the weather can be really tricky because pressure changes, like humidity, like temperature going up, going down. Even if you look at a barometer, it really is only a couple of points on a barometer, but that can really affect people with migraine. If you want, and I'll post this reel today, if you want, I'll probably post twice today, but if I post this, there's a reel that I made the other day. It's just a screen recording of how to find this. A patient actually told me about this who has arthritis, and there's like an arthritis tracker on AccuWeather, but there's also a migraine tracker on AccuWeather. So if you're the kind of person who wants to be able to predict the weather, in order for you to take your rescue treatment, which you should talk about with your neurologist first, and you can go on there and see in your area where the barometer is predicted to go. I mean, it's not 100% accurate, just like the weather tracking isn't 100% accurate, especially with climate change and all those things happening, but it can be really helpful, especially if you live in a place that really goes up and down like this person's saying she lives in Florida, with high pressure and low pressure systems. But you can find that on AccuWeather.com, and I just type in AccuWeather migraine tracker and it will pop up. Unfortunately, it can't go backwards that I've found, and if you find that it can go backwards, DM me and tell me how. But it does predict like the coming week, the coming 10 days, which can be really helpful for people. So someone else wanted to know, you can always keep dropping questions in here, I'll answer them as they come up. Someone wants to know about VNGs, so that's a vestibular nystagmography exam, and that is the test where they test your peripheral vestibular system. And when they test that system, it's usually it tests for a lot of things. It just tests for vestibular system function. It's the one where they put warm or cold air in your ear. They track your eyes back and forth. They put goggles on you. They test you for BPPV. All of that is in a VNG exam. And it's really, sometimes can be really important and really telling if you get it about what's going on. But a lot of people feel frustrated because they get this exam and it says, hey, your vestibular system's perfect. And people are like, I still feel really dizzy. Like there's something going on. I can't figure out what it is. And if that is the case, it can be vestibular migraine still, even though you have a perfect VNG. Just like you can have a perfect MRI and still have vestibular migraine. Vestibular migraine is a diagnosis of exclusion, so it can't be anything else that could be causing your vestibular symptom. I mean, it's common that you have it with Meniere's disease. That's not what I'm talking about. I'm talking about all other possible diagnoses can't be the reason for these symptoms. But it doesn't necessarily affect your peripheral vestibular system, which is what a VNG is testing for. So just because you have vestibular migraine does not mean you will have a positive VNG. So yes, you can have perfect VNG and still have vestibular migraine. Let's talk about fatigue and sleepiness before and after an attack. So there are 4 phases of a migraine. Attack. So you have the prodrome. It happens days to hours before your migraine attack. That's the first part. The second part is your aura, and this will happen for a couple of hours usually before your actual migraine. Actual being the headache phase, which is the third phase. So the headache phase for migraine patients, even though it's called vestibular migraine patients, even though it's called a headache phase, it doesn't actually mean it's a headache phase because, as we know, we do not need to have a headache in order to be diagnosed with vestibular migraine. So let's call it the vertigo or the symptomatic, the impact phase is what some people refer to it as, which I prefer because migraine is not just a headache. And then you have the postdrome phase, which for a lot of people can feel like a hangover. Some people wake up and they feel way more energized, like I'm a new person, and that's great. But for most people, it is fatigue, sleepiness, sort of just like you'd feel like if you had a hangover. So it's important, yes, to know that fatigue and sleepiness are common before and after an attack. And tracking that can be really important because if you have an acute medication and you know when your prodrome is, your neurologist might want you to take your medication in that phase rather than when you're actually having the impact phase. So if you can predict when it is, some people have cravings, some people's sleep patterns change, some people feel really tired, some people, so it's just so different. So if you can figure out when that phase is, that's when you can take your acute medication and it can kind of stave off the attack. Not stave off, but it can help either diminish or deplete it completely. However, it's also important to know that if you are a vestibular migraine patient and there's those 4 phases, dizziness can happen in every single one of those phases. So it's not just to be put in just the headache or the impact phase. Meniere's disease here. My husband won tickets to a concert, nosebleed seats. Should I be worried about triggering an episode? That's really dependent on him. If it's outside, there's less noise, things like that could be helpful. I would recommend bringing earplugs and glasses, like sunglasses, for all the lights and stuff like that. If your husband is really triggered by things, talk to your vestibular therapist about what exactly you should do. But just for everyone with vestibular dysfunction going to a concert, I recommend maybe thinking about glasses and earphones or like over-ear headphones, stuff like that, where you can still hear but will be quieter and less stimulating. But it really depends on you and your symptoms and everything that you do to prevent and treat attacks. Okay, someone asked, when should we stop relying on medication and only rely on VRT? I wish that VRT had that kind of power. So let's kind of separate the two. There's nothing to be ashamed of if you are a person who needs to take medication. And I want everyone to remember that because there are a lot of people who are like, I'm never going to take medication. I don't want to take medication. And I understand that, and I am with you there. I get that most people don't want to just take a medication to treat their disease or their dysfunction or their condition. However, for some people, it's necessary, and you might need it in order to support your body. I think, though, that medication is important for those people, and it's different than not relying on VRT. So vestibular rehab therapy, or VRT, can help you with your functional activities, help you return to exercise. It can help you decrease your symptoms overall. It can help you increase your migraine threshold or your trigger threshold for whatever vestibular dysfunction that you have. However, it is not meant to just get rid of your medication. So there's not a point where you're like, I do VRT now, I'm going to take off my medication. If you want to stop taking medication and you're tracking your triggers, you understand what symptoms are caused by food, by being dehydrated, by not exercising, by exercising too much, by not walking the fine line that is your trigger load, that's when you can talk to your neurologist about tapering off medication. But it's not like, I started VRT today, so I'm just gonna cold turkey cut my medication. That's not a good idea. Talk to your neurologist, ENT, neurotologist, PT about this, and kind of get everyone on the same page and on board in order for you to maybe stop taking your medication. But remember, there's no reason to be ashamed of taking medication. If it's not right for you, it's not right for you, and you should talk to your doctor about that. VRT is vestibular rehab therapy, which is physical therapy for your vestibular system. So it is the concept that strengthens your brain vestibular system connection, basically, so that if you want to move your head like this, you can move your head like that, and you won't trigger an attack or get super, super dizzy. VRT and virtual reality. So this has been becoming more and more prevalent in the vestibular therapy space. If you are a person who does VRT and you want to do it via virtual reality, that is an option in some clinics. I know someone who went to a clinic out of state. They gave her a set of goggles. They put stripes in her goggles that go this way and up and down, and they change them depending on her symptoms and how she's feeling that day and whatever, and it works really well. That's the only person I've met who does that, and I'm not sure a physical therapist gave her that. That's possible, but I'm not sure about that. I think her ENT might have given it to her. There are more and more studies being done about virtual reality and VRT, and I think it's going to be really telling in the next couple of months to years, and I think that'll be really helpful. I did have a pair of VRT goggles that I would use with patients in the clinic before I did strictly via telehealth, and they were like $35 on Amazon. I just downloaded like random Google Glass things that I shoved in people's faces that's like this far away, and that takes up enough of your peripheral visual stimulation, basically, and it can be really difficult to stand up, to stand on one leg, to walk around. And I would of course put her in like a big room, and I'd walk around a little bit, and I would be like right next to these people and making sure that they were really safe. But it can be helpful in order for your vestibular system and your vision system to switch. So you have to your vestibular system has to decide what you are depending on, whether it's your feet or your eyes or your vestibular system or a combination, and switching back and forth all day in order to keep you upright. Balance is a whole rabbit hole that I can go down, but it can help determine whether you're using your eyes or your ears back and forth when you can't see, but you can see. So you can't see your surroundings, but your surroundings are now different. So you can do this with like a paper bag over your head. Do it in the clinic. Don't do this alone, in order to see which one you should be using and train that system. What is the connection between menopause, hormones, and vestibular migraine? Mine started with perimenopause. I cannot tell you the exact chemical reaction that happens here, but I do know that big hormonal changes in people, especially right after you have kids, peri and post menopause, and then for some reason, like in your 30s and late 20s, early 30s, and into your 40s, is when vestibular migraine happens. I cannot tell you the exact chemical reaction that happens there, but I know that it's common. You're definitely not the only person with this. I find caffeine and Advil seem to help. Yes, that is common, but people with vestibular migraine tend to be extra sensitive to caffeine, and so you can actually make it worse long term. This is something that you should talk to your doctor about if you are using your caffeine as a rescue med or not. Advil, ibuprofen, Tylenol, painkillers, NSAIDs over the counter, they can be actually more harmful in the long run because you can get what's called migraine over medication overuse headache from taking medication over and over and over again, or taking them too frequently, taking too many of them. And if it only helps short term, it doesn't actually stave off the actual attack, then it can actually make symptoms worse. So that's something that I would talk to my doctor about. If I were any of you, honestly, just talk to your doctor about all of these things, especially if you have a doctor that you can trust, because a lot of times migraine specific medication is a lot better than having a cup of coffee. And I know there are a lot of people trying to get off of the coffee or Coke train, but some people stay on it and it works really well for them. They just need like one sip and the migraine's gone. So it's really, really dependent on you, but it is common for that to help. Okay. Last question I have on here is, does VRT help with MDTS? So MDTS is maldebarkment syndrome, and that is having basically sea legs all the time. So people who, after they get off of the classic way that people get this is getting off of a passive motion for a long time. So being on a really long road trip, boat ride, ferry ride, that sort of a thing, a plane ride, anything where you are in chronically in passive motion. So you're kind of like this and this and this and this. After you get off, it's really common for people for like a minute and a half to be like, whoa, I feel weird. And like kind of what you walk on the dock or you walk down your driveway and be like, my legs feel funny. Then you adjust. And most people adjust in the first couple of minutes to days. Sometimes it can take days. It depends on you. But MDTS is one that doesn't go away. It can happen spontaneously, but they're working on different criteria for the spontaneous kind of MDTS versus the acquired kind of MDTS that we just talked about. The spontaneous kind, you just wake up one morning and you feel like you're moving all the time. A lot of times that's actually vestibular migraine, and it's either misdiagnosed or someone self-diagnoses with MDTS, but it's really dependent on you. Does VRT help? So this is where it gets a little bit tricky. VRT, the classic exercise-based treatment for vestibular hypofunction, vestibular migraine, vestibular neuritis, whatever condition you have, it will help in MDTS with the functional aspect. So if you're like, I feel like I can't walk straight, I feel like I cannot balance on uneven surfaces, I feel like I can't walk with head turns, that vestibular therapy is excellent for. But the actual feeling that you are moving back and forth like this all the time is not necessarily the best treatment for you. However, if you have a vestibular therapist who is able to reproduce what's called the DAI protocol, it's DAI protocol, you can Google it, then that is an excellent plan of care for you. Basically, they figure out what frequency you're moving at and which direction you feel like you're moving. So you could be like circles, left to right, right to left, forward and backwards, whatever it is, up and down. They figure out what that is for you. Then they move stripes in the opposite direction while passively moving your head in the opposite direction at the frequency in which you're moving. And it's like a 5 to 10 day protocol, something like that. And it is done most frequently at Mount Sinai, which is where the original research was done. And if you can be in a place where you can go to New York City for a couple of weeks or a week and do that protocol every single day, then that's great. It is really effective overall, at least in reducing your symptoms and often getting rid of them. And then obviously avoiding the original stimulus that gave it to you. But if you live in a place where your vestibular therapist can reproduce this, then I would go there. But actual VRT doesn't often help MDTS. That's my very long-winded answer for that. Can I talk about vestibular hypofunction? Yeah, so this is how your vestibular system works. This is really important to know. So you have two vestibular systems, one on each side of your head, and they fire like this all the time. They say, I'm looking forward, I'm looking forward, I'm looking forward. When I look to my right, this one fires more, and this one fires left. And it says, okay, I'm looking to the right. And then it says, okay, I'm looking to the left. And all day long, your head goes back and forth and your vestibular system fires differently. Okay? That is a normal vestibular system. That's how it should work. If you have a hypofunction, then one side is decreased all the time. So let's say it's like halfway down. So in this scenario, this is my right side, okay? I'm looking to the right all the time. That's what my brain thinks. This is how hypofunction works. This side is hypo, meaning functioning less, hypofunctioning. So in this system, I'm looking to the right is what my brain thinks. But your vision is saying, no, you're looking straight. What are you talking about? And your muscles in your neck know where your head is in space, but your vestibular system is telling you this. It says, okay, I'm looking to the right. I'm clearly not looking to the right. And so this miscommunication between your brain and your eyes is really, really confusing. That's where VRT comes in. So vestibular rehab makes you stare at one thing and shake your head back and forth, and then cancel the system and shake your head back and forth and move all around in so many different ways until your system finally is like, oh, I understand, this is normal. So we don't heal our vestibular nerves. Humans, we're not good at healing nerves. We don't regrow nerves like a starfish or something can regrow an arm. Like, we can't do that. We don't regrow nerves, we don't regrow limbs, we don't regrow stuff. So instead, our brain, which is plastic, okay, it means it can change and mold and learns that this is my new normal. And so now I know that even when I look like this, okay, I know that I'm looking forward. And so that's what a vestibular hypofunction is, and that's how you treat it. The next question is about supplements. So B2, D, B12, CoQ10, and magnesium, those are kind of the classic ones that you hear about. They're great. I cannot tell you the dosage, and I cannot tell you the time of day. That is something that you should talk to your doctor about. There are different doctors that say you can take up to 400 milligrams of magnesium. Other people, 500 milligrams of magnesium. You might not be low on vitamin D. You might be low on vitamin D. So blood tests are good for this. And then talking to your doctor about how much you should take and when you should take it. But all of those ones are the typical recommended one, but doesn't necessarily mean it's for you. Do I need a referral for VRT therapy? I've been getting treatment for Meniere's disease from an ENT and family doctor, and have noticed my vision has changed since going back-to-back episodes or having back-to-back episodes. So first of all, do you need a referral to vestibular therapy? Not technically. So in the United States, you have direct access to a physical therapist no matter where you are. I personally, because I practice in so many states, and after like 30 to 90 days, depending in the state you are, your GP or any of your doctors are going to have to sign off on the plan of care if you don't have a prescription. So I require a prescription anyway. It can come from any of your doctors, but it is not necessarily required for all people. I just require it for continuity of care because I am licensed in like 7 states. I've been getting treatment for Meniere's disease from an ENT and from a family doctor. That's great. So that means that you're probably being managed well and things are going well. You have either your medication, your lifestyle changes, your food, diet, whatever, all those changes, excellent. But if your vision has been changing, so you should first get an evaluation from an optometrist and or an ophthalmologist to see if your vision has actually changed or if things look blurry because your vestibular system isn't keeping your eyes in place. So your vestibular system's job, you can all try this with me right now. Stick your thumb out, stare at your thumbnail, and slowly move your head kind of right and left. Don't do it very long. I don't want any of you to get dizzy. But if you do that and your thumbnail stays in place, great. Your vestibular system is doing its job. So for every movement one way, there's an equal and opposite direction movement the other way of your eyes. So if I move my head to the right, my eyes go left as long as my vestibular system is working and I am trying to keep my eyes in one place. Okay, so that if that system, your vestibulo-ocular reflex, vestibular-ocular, the reflex between the two, isn't working 100%, then you can feel really dizzy because your gaze isn't staying stable, and that can make you feel like you have a vision problem because things might be really bouncy and get blurry. It's hard to track when you're reading. So all of those things can be helped with vestibular therapy and vision therapy if the vestibular therapy specifically isn't working for your eyes. Someone did the diet protocol and it's working, but it comes back after passive motion again. Yeah, so avoiding the original stimulus is one of the end parts of the diet protocol. That's great you did it in Belgium. I'd love to know where, if you can DM me and tell me where that is. But yeah, it does come back with passive motion, unfortunately, a lot of the time. And so avoiding the original stimulus is part of the criteria afterwards. Is there an operation performed to cure vertigo? So first of all, vertigo is a symptom, not a diagnosis. There are no cures for vertigo, for any vestibular problem. There are just treatments that you can get in order to treat the symptoms and hopefully treat the source of the symptoms so the symptoms don't recur. But there's definitely no operation. There is one operation, but no one does it. So I'm going to just say no. Okay, I have a lot of pressure behind my right ear, and when I'm looking at something, say a video, it moves to the right and makes my head go funny. I can't tell you what this is, why it happens, anything like that, but it can be vestibular related, especially if there's a lot of vestibular symptoms that include pressure in or behind your ears. It's often a pressure problem. Sometimes it can be a nerve thing. But it's something that you should talk to your ENT, neurologist, neurologist, or vestibular PT about. And if you don't have a vestibular PT yet, I would absolutely recommend that you get one, because this can be the symptoms of things moving and stuff can be treated. What is inner ear caloric weakness and how is it related to VM, vertigo, or vestibular issues? So at the very beginning, we talked about what a VNG is, and a VNG is the vestibular nystagmography exam, and it's the exam where at the very end, usually they put this stuff in your ear, and it's either water or air, and it's either warm or cold. When they do that, it makes your eyes move because it stimulates one of the nerves in your vestibular system that talks to your horizontal canal. So your horizontal canal is the one where if you move right and left, it causes the right and left movement of your eyes so your gaze stays stable. So we test that with the caloric tests. If one of your horizontal canal nerves, the nerve that connects there, is weak, then you won't have as big of a nystagmus on that side. So usually nystagmus is what we're looking for, and it's not such a good thing when we find it, but in this test, it's a really good thing when you find this. So it makes a lot of people feel really sick because you get laid on your side, they put the stuff in your ear and it like goes in and out and stimulates that nerve for about 90 seconds, and your eyes go like this, basically. So uncontrollable eye movement, nystagmus. And the side that has less nystagmus is the side that's positive for a caloric weakness. So it can be related to VM, vestibular neuritis, especially people with Meniere's disease can have a positive one of these tests. Really anyone with a peripheral vestibular weakness or a weakness in that nerve, basically. It can show that there's a decreased basically response in that side, and that side will be the hypofunctioning side. So if we go back to what's a hypofunction, like this, right? If I have a left hypofunction, this, when they put water in this side of my head, in my ear here, my eyes will not beat as much, and that will say, okay, you have a caloric weakness, and that's what VRT is for. It treats that caloric weakness. I have vestibular symptoms on my right, but the therapy has almost cured me. A lot of work, but so worth it. Yes, I love to hear that. Is it common to have constant blurry eyes when the reflex is bad? Yeah, it's called gaze instability, and that is what vestibular rehab treats. I mean, it treats a lot of stuff, but that is one of the biggest ones that it treats. I have double vision and recently developed dizziness symptoms, which haven't stopped for 2 months. Will glasses with prism lenses help? Thanks for your live Q&A. You're welcome. Will glasses, so it really depends. I would just try them. It helps with double vision, but I would also try vision therapy. Things like convergence, where you like stare at your thumb, go in, go out. Convergence on the outside, tracking, all that sorts of stuff can help double vision. If the double vision you've had your entire life, it's something that you should talk to your doctor about and see like what the best course of treatment is, but you can always try therapy. It does seem to help a lot of the time. Vision blurriness, I'm seeing a vestibular therapist. Awesome. Will the blurriness ever go away? If the blurriness is from gaze instability, then yes, it tends to go away. Have you seen people improve to normal function again? Yeah, lots of vestibular patients have normal function. I'm discharging people all the time. I have a caseload, but it's hard to keep people around because it really does work, which I'm happy about. I always want to discharge people. It's better that way. I always want to see my patients again because I really like them, but I never want to see them again because that means they're just 100% feeling great. How much magnesium would you recommend? I talked about this earlier. I cannot say this. It really is dependent on your doctor and what they have to say. I'm not really sure if I have some sort of vertigo. 2 months ago, I started feeling a lot of dizziness, blood test, low iron, low vitamin D, but I've also had blocked ears. So this is a hard one. So I cannot give you medical advice. If you want medical advice, go see your doctor. Sometimes having blocked ears is a symptom of a vestibular condition. I'm not sure if I have some sort of vertigo. I want to be very specific. Vertigo is a symptom. It is not a diagnosis. This is like the hill that I will die on. Vertigo is a symptom only. So if you are having vertigo, it is because of a different cause, and I would ask your doctor what that cause is. Do you believe that food is a trigger for worse symptoms, for example, chocolate or sugar? So it depends on you. For people with Meniere's disease, sugar can be a huge trigger. For people with migraine, some people swear it's a trigger, but a lot of people say it's actually, the research especially says that chocolate is not a trigger for migraine. It's just often a craving that happens during the prodrome stage we talked about at the beginning of this. So it's important to know what your triggers are in order to treat your symptoms with lifestyle and food modifications. Yes, food can be a huge trigger in general for people with Meniere's disease and vestibular migraine, especially because there is a threshold that everyone has. So if you think about your head, let's start here, you have always a list of uncontrollable triggers throughout the day from like here to here. Let's say I usually draw a picture of a head, divide it into thirds. So this can be our uncontrollable triggers. So it's like stress, anxiety, work stuff, the weather, things you can't control that can possibly trigger a migraine attack or a Meniere's disease attack. Then you have the controllable triggers. So am I hydrated? What am I doing today? Did I exercise? Did I eat right? Did I eat 3 times a day? Did I skip a meal? Things like that. If you can decrease the controllable triggers, then your migraine threshold will increase. So there'll be more space between your uncontrollable triggers and your migraine zone or your attack zone, let's say. So if you can figure out what things tend to cause your attacks, whether they are food or water or sleep or stress, whatever that is, then, and it's usually a list of things. It's not one thing. It is a combination of things. It's this is why we call it the migraine threshold theory or the migraine bucket theory, because it's like you're filling up a bucket of things. In order to hit that threshold, then yes, you will maybe get a migraine attack or a Meniere's attack, some sort of vestibular attack. But I'm not saying that every person has the same triggers or trigger symptoms. What pathways do I recommend for vestibular treatment? Find a bunch of vestibular specialists like neurologists, neurologist, ENT, and vestibular physical therapist. Make sure they're a specialist. And ask them their opinions about you, track your symptoms, track your triggers, things like that. What drove me to be a vestibular specialist? It was an accident. I love treating vestibular disorders. Clearly, it's all I talk about. But I started treating vestibular disorders during an internship I had at 360 Balance and Hearing in Austin, Texas, my last year of PT school. And then I applied for a job, my first job out of school, and I got the job. It was at a vestibular clinic, so I've been treating vestibular disorders since then. Now I own my own clinic, which is really exciting. I just really love the population, and I love all of you and everyone who lets me do this job. And I just think that the vestibular system itself is so fascinating, and there's so much more research that needs to be done, and I'm just interested in all of it. I stopped enjoying my life because of dizziness. I'm really sorry to hear that. I really hope that you do get help. All of this can be really, really frustrating, but with a correct treatment plan, a lot of it really can get better. How do you cure gaze instability? Vestibular rehab. Okay, that is also the second hill I will die on. After vertigo is a symptom, not a diagnosis. Gaze instability is treated with vestibular rehab, which is my favorite thing to do. I'm new to these symptoms, so I've been trying to find as much information as possible. I'm so happy that this is helpful for you. Yes, I will save all of these Q&As to highlights, or not to highlights, I'll save it to my IGTV. That's just where it automatically goes. Is it best to be seen by neurology or ENT for full assessment of vertigo, blurry vision, sore ears, heavy floaty legs, etc.? UK-based GP has referred me to neurology, but not sure. So a neuro-otologist, otologist, is the best person that you can see, technically, who's a doctor for this, like a physician for this. If you are UK-based, I have a list of UK providers. Just DM me if you have questions about how to find them. I have a whole list of providers that people on here have given me that they really trust and like, because I know that you can go on Vita, and I love their healthcare directory. I refer people to it all the time. Like, I check it probably a couple times a day for different things. I'm on there. A lot of my amazing colleagues are on there, but it's not everyone. And so if you're having trouble finding someone, especially out of the US, that can be really, really helpful. Okay, again, this will be saved. None of this is medical advice. Don't take medical advice from someone over Instagram or the internet. Only take medical advice from your providers. So, Australian providers, I am working on that. There are a couple people who I'm talking to right now to get the names of their providers. Is a box fit class too much with vestibular migraine? Exercise helps migraine attacks usually, but I can't tell you. I would go and try and take it slow. All right, well, DM me if you have any more questions. I will make sure that this is saved both to YouTube and to Instagram. So if you want to scroll Instagram while watching it on YouTube, you can do that. Accepting patients in Texas. No, I do not have patients in Texas, but the woman who trained me how to do this does vestibular rehab in Texas. So let me know what you're looking for. DM me. Okay, I'll talk to you guys next week. Bye.